I'm Dr. Roy Williams, medical oncologist, PinnacleHealth Fox Chase Regional Cancer Center. It is a priceless opportunity to draw upon the experience, the wealth of knowledge of other physicians, both in specialties that I'm not an expert in, radiation oncology, pathology, radiology, but also with the other medical oncologists who are here today. There certainly had to be at least several hundred years of experience. Today, I was reminded that by the pathologists that the receptor studies on bone tissue may not be as accurate as soft tissue. That is a point that I have to discuss with the patient, and also perhaps we may end up doing another biopsy because of that, which could affect her therapy in a positive way. If Bette had known to be a BRCA1 carrier, frankly, I expect I would have met her before I did. I would have likely have met her when she started having hip pain. A BRCA, a person with a genetic mutation or cancer patients, when they have pain, it's due to something. She would have had a more extensive evaluation at that time. It would not affect Bette's case and management, but it may affect someone, a patient who is treated by a physician who attended this conference today. Another rule, if you will, in oncology is the longer you live, the longer you're going to live. Cancers in general break down into two big categories: chemotherapy sensitive or chemotherapy resistant. Unfortunately, if the initial chemotherapy doesn't work, the second, third, fourth lines are unlikely to work either. I've come to the realization it's not so much which drug you use as it is the cancer you're treating. Bette has responded dramatically to the first two drugs we've tried. I remember Bette initially quizzing me on what my plan B, C, D, and E were. And here we are almost a year later, and we haven't wasted plan A yet. But after this conference today, my plan B may be different because of information that was shared today. The people are why I do this. It can be incredibly rewarding, especially having met Bette initially, seeing that look of fear in her eyes, and trying to talk her off the ledge. And then, almost a year later, she's driving around in her Beetle convertible, living her life. We're in this together.